Hi, my name is Nelson Baker. I am the Community Impact Director for Green Mountain United Way. My office is in St. Johnsbury. Green Mountain United Way serves 5 counties in Vermont: Washington, Orange, Caledonia, Essex, and Orleans. And we have our main offices in Berlin in Washington County, my office in St. Johnsbury serving Caledonia, Essex, and Orleans County. And we have another office in Derby Line, also serving that area of the state. Green Mountain United Way has 4 major initiatives: financial stability, healthy living, early learning, and basic needs. And we're here today to talk within the initiative of healthy living. With me is Rose Sheehan, who had a title of coordinator of the tobacco cessation program at NVRH, Northeastern Vermont Regional Hospital. Now, same person, different title, coordinator of alcohol, tobacco, and other drug prevention task force. And we're very pleased also to have Rebecca Ryan with us. Good morning, Rebecca and Rose. Rebecca is the Director of Health Education and Public Policy of the Vermont Division of the American Lung Association. I think I got that right.
You got that right.
And our topic today is smoke-free multi-unit housing in Vermont. We'd like to have that discussion about why we're having this initiative, what it means to the people who are living in multi-unit housings, and the efforts that are going on in that area. So let me start first with Rose, because Rose has been very active in this for a long time, as I'm sure Rebecca has, but at the local level for you. So tell me why this is important to what you're doing within our area.
Okay, so of course you know, Nelson, that one of my favorite, one of the most important pieces of my job is tobacco. It's something I'm really passionate about. And for years, for at least the past 11 years, we've been working on educating people about the dangers of secondhand smoke and doing initiatives around adopting policies to reduce exposure to secondhand smoke. So we've worked with parks, we've worked with workplaces over the last few years. Last year we did an initiative for smoke-free parks across Vermont. And in this past year, we have now taken on this new initiative, which is smoke-free housing. And so smoke-free housing fits in perfectly with everything that we've been doing for the past 11, 12 years, which is to reduce exposure to secondhand smoke. And of course, that's important because of the dangers. We know secondhand smoke is the 3rd leading cause of death in the United States, preventable death. And that it's really harmful to people's health, especially children and elderly, or people who are sick already, who might have COPD or emphysema or heart disease, those kind of things.
Mm-hmm. Rebecca, how does the American Lung Association, specifically the Vermont Division, get involved in this?
So the American Lung Association is the oldest voluntary health organization in the country. Our mission is to save lives by improving lung health and preventing lung disease. And we do this through education, advocacy, and research. One of our primary goals since the 1960s has been to reduce the devastating impact of tobacco use, including reducing secondhand smoke exposure. Vermont has done a fantastic job in reducing secondhand smoke exposure through legislation and education. In 1987, we were actually, I think, probably the first state in the country, maybe California came before us, but to ban smoking in most workplaces. In 1993, smoking was banned in most restaurants. And then in 2005, all restaurants, smoking was banned, and then smoking in bars and also private clubs was banned. In addition to that, the health department's been doing a great job of educating Vermonters about secondhand smoke exposure. However, these laws and a lot of this education has really been directed to protect adults. And as Rose said, kids and seniors are most vulnerable to secondhand smoke. Kids, unfortunately, are still being exposed to secondhand smoke in their homes and in their cars, and that's why we have really been working hard on educating folks about smoking, not only in their private homes, but also how their neighbors' smoke impacts them in multi-unit housing.
Are you working under a federal grant of some kind?
Yeah, well, we got started, the number one complaint to our office in Williston for years has been, calling us up and saying, hey, I bought a condo, I didn't know my neighbor smoked. I'm renting an apartment, I thought the building was smoke-free, what can I do about this? And for me personally, it was just really hard because I could listen, but I couldn't offer really any concrete steps to take because there's no laws protecting people from those things. So we were able to get some funding probably 5 years ago from the health department to create a website, and that website is smokefreehousingvt.org. So for folks that are interested in this issue, it's smokefreehousingvt.org. And it's got some great resources for landlords and tenants as well to help them either talk about the issue or create a policy to protect everybody in the building. Currently, we have a grant from the health department that's a federal grant. It's a community transformation grant. And I can talk about what the Lung Association is doing, and then Rose, in addition to what's going on up here in the Northeast Kingdom. But this has given us the opportunity to really focus on folks that are living in subsidized housing, meaning government subsidized funds for moderate to low income Vermonters, because the rates of smoking are much higher in those populations. To provide technical assistance and support for both the landlords and the tenants to consider policy and help them implement it and enforce that policy. Mm-hmm. So that's we're in year 2, I think, of a 5-year, hopefully a 5-year grant.
Rose, what's going on in our area? I know that you've been working with Rural Edge.
Yes.
Formerly Gilman Housing Trust. People are familiar with that name. We're getting now used to the new name. But what's going on with them, and what are you doing in that regard?
Okay, so back in August, I reached out to Rural Edge because, of course, they have the most multi-unit housing in our area. And I learned that they also have a mini grant from the Community Transformation Grant, right? Mm-hmm. That's the title, mm-hmm. To work on smoke-free housing. So we decided, well, we need to partner together on this. And in talking to Lori Neely, the director, I learned that there was some residents or tenants at Mountain View Apartments mm-hmm. that were interested in this issue. They had been complaining and talking amongst themselves and to property managers about their concern over the smoking and the smoke going into their apartments. So I said, well, can I meet with some of those tenants from Mountain View? Because it seemed like that would be a good place to start. Because one thing that was really important to us, Nelson, was that we wanted to include the tenants. We wanted to do a project that would get the tenants involved right from the start to find out how people feel about this issue, because this is a brand new initiative for us. So we felt like it was important to get them involved, ask their opinion, see what they thought of this. So we did a survey. And the survey, through that, we learned that about 55% of the people who filled it out were in favor of 100% smoke-free housing. And then there was a certain percent that were interested in like designated areas outside. So that told us there was enough interest that we need to keep meeting with these folks. So we've been meeting with them once a month. We go to Mountain View, we have a dinner, and each month we educate them about secondhand smoke and the benefits of smoke-free housing, because each time new people will come. So you have to kind of keep educating. Mm-hmm. And then, so the feeling has been right along that this is the way to go. So after 3 or 4 months of meeting with the tenants, we went back to the director, Lori Neely, and gave her the information from the tenants that said, yes, most of us here are in favor of this. So now where we're at with it is the director is now working with her higher-ups who are part of HUD, and senior management, and they have to figure out what is the cost to implementing something like this, and how do we do it. So what they're saying is, we want to do this. This is something we do agree is important. We want to do it, and they're making a goal to do that. The question is how costly is it going to be? How much can we do in what period of time?
Of course, there's also the issue of the cost of not doing something in terms of healthcare and illness and other disabilities.
Yeah.
And can I add to that even though Vermont requires that cigarettes be fire safe, they're not fireproof. So smoking is still the #1 cause of fire deaths in the U.S. So it could still, catch an apartment on fire. And in addition to that, it's very expensive to turn over an apartment that was formerly occupied by a smoker.
In
So
terms
it
of
will
cleaning
save,
it
yeah. And then finally, some can save costs on insuring their property if their property is smoke-free.
Let's talk for a minute about the conceived rights that people have. Somebody might say, I have a right to smoke. Somebody else might say, I have a right to live in a smoke-free environment. Let's talk about that for a minute.
Sure. Smokers are not a protected class. So in fact, a person that has a disability, which would include chronic lung disease, can claim that their rights are being violated because they're being exposed to secondhand smoke from their neighbor's unit. So I know it's a tricky issue, but everybody deserves the right to breathe fresh air, and there's no safe level of secondhand smoke. We're not really targeting the smoker. We're really trying to just eliminate secondhand smoke. So, smokers are used to being now in environments where they have to take it outside, and we're just asking that to be done within multi-unit housing as well.
Now, I read some material, some of which was provided by you, of how secondhand smoke can travel within a building. So if somebody has an apartment unit and they feel that they're smoking in their apartment, and maybe they've opened the window, that they're not affecting anybody else, but they really are.
They are.
And can you tell us how smoke actually travels from one unit to another within a building?
Yep, smoke, it's a gas, and so it expands and it rises. It seeps through, no matter how airtight a building is, it's going to seep through microscopic cracks, through the outlets, through the window frame, through the doors, and shared ventilation systems. In fact, I looked at a study that showed that the person, for example, I can't remember, I think that the smoker lived on the 2nd floor, and they put air quality monitoring units across the building, and the person that was actually living on the top floor was getting way more particulate pollution, which is quite dangerous to human health, than those that were living on the same floor as a smoker. So it's actually more dangerous if you're living above.
And what are the chemicals that are contained in smoke?
Pretty much you name it. There's over 7,000 chemicals in secondhand smoke. 69 of those are considered cancer-causing. We've got formaldehyde, carbon monoxide, arsenic.
Arsenic, yeah.
Just the study came out 2 weeks ago from Johns Hopkins, looked at 10,000 children who were exposed, some of which were exposed to secondhand smoke. Their parents smoked, and some that were not. And the kids who had lived with one smoker were having 14% higher lead levels in their blood. 2 smokers, it increased to 24%. So, lead, the government really has strong regulations around lead, yet our kids are being exposed to lead in their personal homes and in multi-unit housing. Pretty frightening.
What's the landlord's position on this? Have you studied this, looked at this, talked to landlords? Are they in favor of it? Are they opposed to it?
There's already a good number of landlords who don't allow smoking in their units.
And they have a right to do this?
Yes.
Okay.
Yeah. So they're in favor of it, especially when they realize the savings, the cost savings. So there's a lot of private landlord owners that are already doing this. But Nelson, I was thinking about the first meeting that I had with Mountain View, and we had some tenants that were smokers and several that were not. And the smokers were really passionate and really emotional about this issue, and in the beginning of the meeting. But by the end of the meeting, there was one woman in particular who she was a neighbor to one of the people who came and had actually kind of was one of the first people to say, hey, we need to do something here, because she has an illness. And so they're neighbors. And this woman didn't realize, the smoker did not know that she was bothering this woman, that this woman could smell the smoke in her apartment. She didn't understand and know that she could actually be harming her. And that really, by the end of the meeting, she felt so bad. And she started smoking outside after that. So and it just was interesting to me that she didn't know, and it bothered her. Smokers don't want to hurt other people. And we know that too. When they realize and understand the whole picture and what it's doing to other people, most of them want to change. They don't want to harm people.
Now, Mountain View is an apartment complex in St. Johnsbury, is that correct?
Yes.
And how many residents are there, do you know, offhand?
Oh boy, I know there's there's close to 100.
Okay.
I don't know the exact number, Nelson. We've been getting like 12 to 15 tenants that come to our meetings regularly. But there's also, we've reached out to tenants at Pasumsic View, which is on Railroad Street.
Right.
And we've also been working down at Clark's Landing in Groton. These are other places owned by Rural Edge. And again, across the board, people are saying, yes, we understand. Down in Groton, there's a woman who, I just completed a class down there, and we did kind of a combination of smoke-free housing and tobacco cessation. And this woman is 82 years old, and she has smoked most of her life. And she told me, she said, since she moved into this place, she does not smoke in her apartment. She said, I don't want my apartment to stink. She said, and I don't want to stink up anyone else's. She totally understands this. She smokes 4 cigarettes a day, so she's like, I'm 82 and I don't want to quit. She said, but I don't smoke in my apartment, and I totally agree with this idea of protecting my neighbors.
So there's really, the strong push is on education at this point. There's no legislation pending that would prohibit smoking in a public building?
No, there is not.
Not a public building, but multi-unit.
Multi-unit housing, yeah. We provide templates for folks that are looking for model policies, but there's no legislation pending, as far as I know, on this issue. Burlington Housing Authority is gradually moving all of their buildings to smoke-free policy. I know Cathedral Square has been doing a lot of work on this issue. A number of their buildings are smoke-free. Rutland Housing Authority, Rutland Land Trust buildings are smoke-free, and then I just heard the Vermont Housing Authority is going smoke-free in the very near future. So there's been a lot of really great voluntary efforts to do this, and doing the right thing that Rose is talking about in this area of the state is really engaging not only the building managers and the landlords, but getting the tenants involved in it.
And if a building is smoke-free as a result of the initiative of management or the ownership, how is that enforced?
Yeah, that's a great question. It's like this. Everybody said when we said, smoking should not happen in bars. Everybody said, well, how are you going to enforce that? Well, it becomes self-enforcing. What we're really doing is changing a social norm, and people just get used to it. There'll be somebody occasionally that will sneak a cigarette. We know that, but most people will comply with the policy, once it's in place. And I think the more buy-in you get, and the more inclusive you are in the process, the better off you are in the end.
It's interesting to me. I used to own a business, rather substantial business, a truck stop in Vermont. And when Vermont passed its law saying there'll be no smoking in any portion of any public building, I welcomed that. I removed all the ashtrays from the tables. And what we found was there was some resistance, but people said, okay, I'll just smoke outside. But what we found was that our business increased because people who weren't coming before, because there was smoking, started to come because there was no smoking. And it made a big difference, and it was a positive impact for us. And I suspect that it will be the same with housing. If I were moving into a unit and there was smoking there, I probably wouldn't do it. But if I knew that it was a smoke-free environment, then I would be encouraged to do that. So yeah, I can see that. What do we consider multi-unit housing to be?
That's when I get calls.
Not
if
a trick question.
Yeah, if I get a call and you're where you live is connected to another unit, I consider that multi-unit. So
Okay.
I just talked to somebody that bought a condo, and I think there's only 6 units in her complex, but she's getting bothered by her neighbor's smoke and was told that the buildings were smoke-free. So. Yeah, but for the purposes of our grant, we're really focusing on rural communities, and that includes the Northeast Kingdom. Rutland is part of that. But in terms of, multi-unit housing, we'll try to help anybody who's interested
Sure.
in implementing policy.
I mean, I try to walk every day around St. Johnsbury area around my office, and I see a lot of housing that at one time was probably a single-family house. Big homes that were here 100 years ago. And now you count, and there might be 5 or 6 electrical meters on the outside of the building, indicating to me that this is obviously multi-unit housing, and there are that many families living there. And it would be entirely up to the owner of the building or the management of the building to change a policy from smoking to non-smoking. Is that correct?
Yes, they can do that on their own. Yeah. And I think in a lot of cases, it's a matter of just letting folks know and putting up signs, please don't smoke. But for some, especially the big complexes where you might have a lot of smokers, it really needs to be a process that everybody needs to be engaged in order for it to be effective.
And with Rural Edge, they as they turn over apartments, these places are redone every few years, and as they're doing that, they are making the units smoke-free. So that part's pretty easy because it's already been scheduled, it's already in their budget. They've already planned for that, and as they're doing that, those units become smoke-free. The challenge is if they have a building or a complex that is not scheduled to be updated or redone. That's where they have to really figure out the cost to being able to do that, and that's what they're looking at right now.
Because we mentioned this earlier, that there's a huge cost to not
That's
making
right.
this conversion.
Yeah.
Right.
And they see that.
Right.
Yes.
When somebody moves out, when a smoker moves out of a unit, there's a tremendous cost in cleaning that unit so that it doesn't contain smell and stain and
Yeah,
other things from smoke.
the latest number that I saw was close to 4,000, and that's just an estimate. It could be more than that
To clean the
to
unit.
clean up
For
a
a one-bedroom apartment.
one-bedroom apartment. Whereas if it's a non-smokers, it's less than 600, right?
Yeah.
Yeah, less than
Yeah.
600.
Yeah.
So that's a
It's significant.
yeah.
So it's really to a landlord's advantage to have smoke-free housing that he owns,
Yeah.
or she. What about animals that are in multi-unit housing developments? What's the effect on an animal?
Yeah, that's it's interesting because that sometimes if a smoker doesn't really the human side doesn't really interest them that much when you start talking about their pets.
Yeah.
They're surprised that because you can, secondhand smoke causes cancer in dogs and cats. Then there's the issue of if my dog will eat anything that's. He had his head in we pulled out our wood stove bin the other day to clean out the ashes, and he had his head in there. So he'll eat anything that if a dog eats the remainders, the butts, that's very, very dangerous. Can cause dramatic respiratory stress in an animal. So it's dangerous to animals. It's just like humans, dangerous to humans.
That's
dangerous
another
to animals.
motivator for
Yeah.
people. Yeah. Yeah. Huh. Well, I know Rose has been active in this for a long, long time, and I've worked with her on some of these issues. We did a panel discussion here on KETV about a year ago.
About a year ago.
With some delightful people, a mother and daughter, who took on the initiative of trying to have smoke-free areas in
state parks and
state parks
forests.
and beaches and hiking trails.
Yeah.
What happened with that?
It happened. The parks folks got together and said it's time to do this. And so there wasn't a law passed. It wasn't done through legislation.
Right.
The park at the state level decided
There was
they
a
were
bill
going to.
proposed, though.
There was a bill proposed, and that didn't get passed.
Right.
But what do you?
It was on the wall. It was.
Yeah, they made a rule.
Yeah.
And so it essentially did the same thing.
Right.
So now when you go to a state park or forest area, you're going to see no smoking.
Yeah, there are still some loopholes in some of the smoke-free laws, and there's a bill introduced this year to clean those up, and that would include, for example, hotels can still permit smoking within a hotel room, not the lobby, but the actual sleeping quarters. And and workers are exposed to secondhand smoke from those. And then I think in this bill is also included a perimeter. I forget if it's 25 feet, but of state-owned and leased
I think
property.
it's 50 feet.
50 feet.
50 feet.
Yeah. So I'm not sure if that's going to go anywhere this year, but that would make us, pretty much 100% smoke-free state.
No, I remember people being able to smoke on airplanes, and that air just kept getting circulated throughout the whole plane. And I guess at one time we didn't realize how dangerous that was.
Right. Lieutenant Governor, the former Lieutenant Governor Doobie, who is a pilot for American Airlines, I think, used to love to talk about the tar that they used to get, that would accumulate in the jet engines from the smoke on the planes.
Wow.
Yeah, we've come along. We have come a very long way. Yeah.
But this is still a long way to go.
Still,
And
yeah. Well, we're up against a huge, marketing machine that's always, 10 steps ahead of us with the tobacco industry coming up with new ways to addict children, and they have unlimited marketing dollars. So this problem's, I think Rose and I both agree we'd like to work ourselves out of a job.
Yes.
Oh, sure.
It's not going to go away.
Sure.
We just have to keep the pressure on.
And most of us who are in the nonprofit area feel the same way. I mean, I teach financial literacy, and I wish I didn't have to. And, we're part of the Fit and Healthy Coalition at NVRH and do a lot of work with everything from obesity to exercise to non-smoking, all these activities. We wish we didn't have to do that. Basic needs, I wish we didn't have to worry about fuel assistance for people, but that's all part of what we do. So would I like to work myself out of a job? Sure, I'd love to.
Right.
All right, well.
Can I just add
Sure.
one more thing? The idea behind these policies is not to force smokers to quit, but most smokers say they want to quit smoking, and they try multiple times. The other wonderful thing about being in Vermont is that there's a great support system out there through the Vermont Quit Network, and the work that the hospital's doing under Rose's leadership is amazing support for smokers who are ready to quit. They can also, if they don't have time to participate in a group, they can join via the phone counseling at 1-800-QUIT-NOW, and then there's also web support too. And in addition to that, the state provides a certain amount of free nicotine replacement therapy, which doubles a smoker's chance of quitting smoking.
And of course, as more people quit smoking and the numbers change of smokers and non-smokers, it makes this job easier because there just aren't as many smokers as there used to be.
Right.
Yes.
Right.
And the social stigma is so much stronger now than it ever used to be.
And I'm really hopeful, Nelson, because of all the work that's going on in schools. And like even at Mountain View, about 3 or 4 weeks ago, we had a poster making event and invited the kids who live at Mountain View and the other buildings also to come and make posters. And we had a full house. We had a full house. We had tons of kids there making posters, and they had to share their poster. And the goal was, when we're done with this, is we're going to take some ideas or some of the pieces from each of the posters to make the sign that will then be posted throughout the development.
Nice.
But to hear the kids talking about why you shouldn't smoke and to be explaining why secondhand smoke is dangerous, that gives me a lot of hope.
Good.
Kids are smart, and we are seeing the numbers go down. We just got to keep doing this,
Sure.
and kids are getting smart.
They always have been.
But they're getting really smart. They're choosing not to smoke, and let's hope it stays that way.
Oh,
Right.
That's great. Well, let's wrap this up. Rebecca, if people want to see more about this or go online, would you repeat that?
Yeah,
website?
sure. The website is www.smokefreehousingvt, that's all one word, .org, and you can click Contact Us, and those emails will come directly to me, and I'll respond. You can also call 1-800-LUNG-USA, and you can connect with the Vermont office.
Good. And Rose, how do people get a hold of you?
They can call me at 748-7532.
And that's at NVRH, Northeastern Vermont Regional Hospital.
Yes.
Okay. And for information on any of our activities at Green Mountain United Way, you can go to our website, which is www.gmunitedway.org. My email address is nbaker@gmunitedway.org. And my phone number at my local office here in St. Johnsbury is 802-745-0101. Rebecca and Rose, I want to thank you very much. I think this has been a good program for people to think about and be encouraged by your activities. So again, thank you, and I think that'll do it.
Thank you.
Thanks.
Thank you.
Thank you very much.
Okay.